It's time to change the way you think about medical school, to think beyond the classroom and focus on experiential learning, the hands-on experience you receive as a part of your medical education. At the University of Texas School of Medicine at San Antonio, it's that hands-on clinical skills experience that is the difference to creating better prepared physicians for tomorrow.
A foundation of our medical education programs is the development of clinical skills on the part of our students.
I think one of the unique traits about our School of Medicine here in San Antonio is that we have patient care from day one.
The medical education you receive at the School of Medicine offers a comprehensive didactic program, but it's the many opportunities for students to immerse themselves in hands-on learning that makes the student experience so much richer here. At the University of Texas School of Medicine at San Antonio, experience is the difference.
Very happy to be here today with you and try to explain a little bit about the sleep disorders. So fatigue is a very common symptom in patients that have cancer. And many times is that fatigue is secondary to different conditions with cancer. But many times this is secondary to some sleep difficulties. So let's talk about insomnia. So insomnia is a very common sleep disorder. Insomnia means people that have problems falling asleep, staying asleep, or they feel that the sleep doesn't make them rested or refreshed the next day. So most common sleep related complaints in patients with cancer is difficulties falling asleep, staying asleep, or many awakenings during the night with inability to fall asleep again. So risk factors for insomnia, we have the cancer, secondary to pain, shortness of breath, nausea, treatments like steroids, like a hormonal replacement in patients with breast cancer that can produce like a hot flashes at night. Also medications, environmental factors when they have been hospitalized, the temperature, the noise at the hospitals, psychosocial factors like depression, anxiety that are very common in patients with cancer. So many studies have shown that patients don't talk about these problems with the doctors. And why is that? 80% they assume that the insomnia is secondary to the treatment. 60% they think the symptoms are going to go away soon, and 50% they think the doctor cannot really help them. So some studies done in different type of cancer population have shown that 30 to 50% of patients that they were recently diagnosed with cancer or they have been going to treatment, they have difficulties sleeping. And 23 to 40%, they still have difficulties 5 years later after finishing treatment. So it seems that many times when patients with cancer develop insomnia, this can be a chronic problem more than an acute problem. So there are some predisposing factors for insomnia, like females have a higher tendency for insomnia, getting older, family and personal history of insomnia, and any kind of psychiatry disorders like depression or anxiety. There are some precipitating factors: hospitalizations, radiation, bone marrow transplantation, chemotherapy, hormonal replacement, pain, and delirium. And some perpetuating factors. These factors are going to make more pain when the patient is not sleeping well. So the clinician needs to include these questions always when they see a patient with cancer. And it's important that the patient talks with the physician about how they are sleeping.
Hi, I'm Wendy Crabb. I'm a nurse practitioner here at CTRC, and I work mostly in the breast clinic and with head and neck cancer patients. I've been an oncology nurse for over 25 years, and this topic is important to me because all my patients complain of fatigue, and almost all of them complain in one way or another of trouble falling asleep. So That's why I am interested in this topic. And you may wonder why your healthcare provider doesn't always address fatigue or insomnia. And with fatigue, it's an expected side effect of treatment. So we may be more worried about your blood counts, nausea, vomiting, or another symptom that you're complaining about. So one of my objectives for this talk is that you know how to talk to your doctor or healthcare provider about fatigue and insomnia, okay, and how much it's affecting your life. A recent article in the Clinical Journal of Oncology Nursing focused on how cancer-related fatigue and disrupted sleep are associated with one another, so that the management of either symptom may help the other. So, and that, you kind of think, well, that makes sense. Why didn't we think of this before? But they're just really focusing research on some of these issues now.